Hello everyone, I'm Almira Fatahova, Project Manager for MedVision, and I'm here today to introduce you to our pediatric patient simulator, Arthur. I would like to tell you all the benefits and features of our product. To begin with, I would like to describe the Arthur configuration set, which includes the human patient simulator, which imitates the body of a child of 6 to 8 years old. Then we have an instructor tablet PC, the bedside monitor imitator, self-adhesive defibrillator electrodes, ECG electrodes, ECG and defibrillator adapter, which makes it possible to use real-life equipment. So you can use AED of any type in your training. Then we can offer a smart scope which can be easily fixed to a real-life stethoscope for auscultation. The system runs using Wi-Fi, and a Wi-Fi router is also included into the set. Now let's have a closer look to the benefits and features of Arthur. Arthur supports realistic articulation in all joints, which means that it has realistic articulation of the neck and the limbs. The neck and the limbs provide true-to-life flexibility and resistance of the feet, hips, the knee, wrist, elbow, shoulder, and the neck, forward and backward, and from side to side. Let's begin with the eyes. The eyes are fully programmable. They respond to light. You can also change the size of the pupils in the software, so the pupils can be dilated and constricted. You can also change the blinking rate. You can make it fast or normal or slow, and the reaction can be unilateral or bilateral. You can also change eyelid position, so the eyes can be half open or fully closed. Arthur has realistic airways supporting all airway maneuvers, so you can do the head tilt, chin lift, and jaw thrust maneuver. The Arthur airway anatomy repeats the anatomy of a real human, so you can see a soft and inflatable tongue. Arthur can imitate tongue edema. It can be adjusted either to 50% or to 100%. Arthur can also imitate tongue fallback, pharyngeal obstruction, laryngospasm. To continue describing the features of Arthur, I would like to say that in addition to intubation procedures, you can also perform invasive procedures such as cricothyrotomy, and for these purposes, Arthur is equipped with a special replaceable part, which you can change every time you finish the exercise. If you want to redo or repeat the exercise, the only thing that you should do is to move the neck skin and continue using the simulator. I would like to pay attention to the skin of the simulator. It is whole, seamless, durable, elastic, and true to life in its appearance and feel. Due to the quality of the skin, you can do manipulations as many times as you want because no signs are left. The Arthur's respiratory system allows producing unilateral and bilateral chest rise and fall. And in the instructor software, you can adjust compliance for both lungs and resistance for each lung individually. Arthur produces spontaneous breathing, and it can also support mechanical ventilation using real-life equipment. With Arthur, you can imitate left-sided and right-sided tension pneumothorax. Arthur is capable of detecting esophageal intubation. In this case, the chest rise and fall stops, and we can observe the stomach inflation. Another thing to mention is that in case of left-sided or right-sided tension pneumothorax, Author supports needle decompression. Author has lifelike anatomy with palpable ribs and palpable collarbones. Its true-to-life anatomy provides all necessary landmarks. So if we find the second intercostal space and insert the needle there, we will hear a rush of air on successful decompression. With Author, you can develop auscultation skills. For these purposes, we use smart scope together with a real stethoscope. Author provides 5 heart auscultation points, 4 bowel auscultation points, 5 anterior lung auscultation points, and 6 posterior lung auscultation points. Author supports palpable pulse, bilateral, carotid, brachial, radial, tibial, dorsalis pedis, femoral. Each pulse is programmable and you can make relevant settings in the software. So you can adjust the pulse strength and make it weak, strong, normal, or none. Another feature of Author is that you can measure the blood pressure using a BP cuff, and Author can produce the carrot cough sounds. Author is equipped with IV access port and bilateral I/O access port system. To perform IV drug administration, we have a set of syringes of various volume and a wide library of RFID tags to be attached to a syringe. The rate and the volume of a drug that you have chosen can be set in the software, and then you use the axis which is found on the interior region of the right hand forearm. One of the benefits of Author is that he can produce different types of convulsions, tonic and clonic, according to your case scenario. With Author, you can easily create the patient-provider communication, as Author has a good library of preset phrases and sounds like screaming, coughing, crying. So Author, how are you now?
I feel better now.
Wonderful. So now I would like to tell you what you should do to start the operation of Author Patient Simulator. So step 1, you should plug in and switch on the external Wi-Fi router, which can be located anywhere in the simulation room. Step 2, you should turn on the patient simulator using the switch button. Step 3, turn on your laptop or tablet PC, which will run the instructor software automatically. And then you should start the patient monitor imitator, which is optional and can be included into the Author configuration. You will find the switch button on the left shoulder of Author Patient Simulator. Just remove the silicone tab and you will see the switch button. While the simulator is on, the switch LED is green. Under the switch button, you will see the port for battery charger. So if you need to recharge your batteries, just insert the power cord into the port. When the charging begins, the switch button flashes. You can still use the simulator while charging. Internal batteries provide 8 hours of tetherless operation. Now let's have a look at the right shoulder of the simulator. Under the silicone tab on the right shoulder, you will find 2 ports, one for Ethernet connection and the other for BP cuff. To be able to measure blood pressure, just insert the BP cuff tube into the port and rotate. To remove the tube, just rotate it back and remove. In case of a weak Wi-Fi signal and multiple interference, you can use an Ethernet cable to connect the patient simulator with your laptop. Author has I/O access on both legs, so if you want to remove the consumable element, remove the silicone band and use a special key which goes with the patient simulator. Rotate and remove. Take a new one and insert and rotate. Thank you for watching. For more information, please go to our website, medvisiongroup.com. You can also find more videos about our products on our Instagram and YouTube channel. See you!